Hi, my name is Maya. I'm a first-time mom of one, and I live here in Colorado Springs. Before I came to the healing spot, I was having some very bad back pain, like lower back pain, sharp, kind of dull, always there. And then I was also having very painful intercourse. And I finally told my midwife when I was like 25 weeks pregnant, and she suggested coming to the healing spot and working with Justine. So, with my back pain, I was really struggling to get things done around the house, and I like to move. So, I was always moving, obviously, but it just kind of kept getting worse and worse and worse. And I wasn't really listening to it. And then eventually it got really bad to where I would be laying in bed at night after the day was done, and it would just be like a sharp pain, and it'd take forever to kind of go away, and I'd have to lay really still. And then obviously with the intercourse, it was affecting intimacy with my husband during pregnancy. Whether you want to do that during pregnancy or not, I guess. But it got really bad, and I got so bad eventually that I just finally did reach out to my midwife and was like, I don't think this is normal. And it turns out it wasn't normal, because online it'll tell you it is normal when it's really not normal. I did, like, prior to coming to the healing spot, I did I was in chiropractic care. It was like every month to 2 weeks, and that wasn't really helping a whole lot with what I needed help with. And so I looked online, and I had my like little yoga ball, and that didn't help too much because I was trying to stretch it out or rub it out, and that wasn't helping a lot either. So I needed something else better. When I first heard about the healing spot, I pretty much reached out the same day. It was probably a couple of days. And at first, like, the price kind of was like, oh, I don't know. But it wasn't the hugest deal for us and our family necessarily. It was just, for me, it was more like, I hope it's going to help. When I first called them, the receptionist was very nice and very inviting. I felt very at home talking about the issues I was dealing with. She ran me through a whole bunch of questions, and she really cared. And that kind of alleviated my concerns and my fears and kind of hesitations. So I was like, okay, I can do this. And I came in, probably, they got me in quick. It was probably within, I'd say, a week and a half. I came in for the discovery session, and it was very inviting, no pressure. Even if I would have decided, you know what, this isn't for me, it would have been fine. There wouldn't have been any pressure to kind of sign up now, or you have to do this, or you're gonna like wreck your whole life, that kind of thing. So I felt very comfortable with them. What made me feel the best about working with the healing spot and Justine was, one, I don't know if there's anyone else in the city who does pelvic floor therapy, and Justine was the only one who kind of offered what I needed at the time. And then two, when I first came in for not the discovery session, but my second session here, I met with Justine, and she was very inviting and didn't pressure me into, like, she told me everything that I want that we were going to be doing that session. And she took the chance, like, maybe like 15 minutes, she took the chance to kind of get to know me, get to know my story. It wasn't just about, oh, what are you dealing with? Let me help you. It was about like getting to know me as the person. And as a pregnant first time mom who didn't have any friends in here in the city, it was very nice to like have that kind of warm, welcoming friendship. And I don't know, I really appreciated that. So when I first came to the healing spot, Justine walked me through like how they do external work, and it's very slow going, and you kind of tell her like, okay, this is enough. They also do internal work intravaginally, which I was very nervous about, because nobody likes another person kind of going up into your own space, because that's your your space and it's your like it's out of your comfort zone. And when we first started doing it, she was very slow going. She explained everything. She gave me the privacy I needed and wanted. Um, it's not like you're just laying there exposed. You're covered. She's not looking, and it's you can tell her at any point like I need to stop or this is enough. And I did have to say that a few times, like I can't do it anymore, like this is enough, or I don't want to do it this session. And we would work on other things, and there was no pressure, there was never any guilt about saying like I can't do it today, or you know what, this isn't for me. Um, it was always like, okay, we will work on the things we can work on and get you as healed and healthy as you need to be. So life now is great. One with the lower back pain. I remember one time I came in here and it was just really bad, and or, and Justine did this exercise with me on my lower back, and it alleviated it a ton. So it was like that really helped. And then after I had my baby, um, the back pain was pretty much non-existent anyway because there's not all that stress pulling you forward. So now I'm like 6 months postpartum and I'm feeling very strong. Justine had given me some low pressure fitness exercises, which I was doing when I was coming here. I was doing them pretty religiously. But after I stopped coming, I did them like pretty religiously the first 2 weeks and then kind of fizzled out. But I started swimming and swimming more. And I've really like gained strength back. And I could tell with those low pressure fitness exercises, if you're even 3 months postpartum, like you can do that because it's so easy to do. You don't feel like you're doing anything, but the next day you wake up and you're very sore, so you get stronger. And every woman wants to get stronger and have their body back after pregnancy. So that's always a plus. And so those really helped me. Now I have pain-free sex, which is great. Um, and I don't know, I'm living life to the fullest. I can go out hiking. I can baby wear. Well, that was one thing. When I was going to the Healing Spot physical therapy, I really wanted to be active, more active, and know how to like do that without wrecking my body. And so Justine helped me to where no, I can baby wear in the right posture so my back isn't throbbing by the end of it, and we can go hiking and we can go walking and scootering, and it just helped me get my life back. I'd say if you are considering pelvic floor therapy, don't worry about the cost because Justine will work with you. Don't worry about the time, or even don't worry about, oh, I don't have childcare, because you can bring your baby here and bring her into the session, your baby into the session, and it's fine. They work around it. Justine's very good about like if the baby starts getting fussy, Justine can help, or you can lay the baby on your chest while you're doing your session. But there really isn't any excuses to not get help, because if you just live with it now, then it's just going to get worse and worse and worse and worse. And then you're going to wake up a year or two later and not be able to move or not be able to enjoy the things you want to enjoy because you didn't get help when you needed the help. And I say you can't put a price tag on that. You really can't, because you're going to be losing more time um not living your best life than you would just like paying or doing the therapy now, taking the time to do it now, and living your best life and getting back out in the world and being the best mother you can be to your child.